Hello guys, it's Chemotherapy Francis back with another video. Now before we get started, please make sure to subscribe. Also turn on your notifications so that you will be notified whenever I upload a new video. Today we will be covering cancer. So cancer is the second leading cause of death in the United States, and breast cancer is highest in females and prostate cancer is highest in males. So a little bit about pathophysiology. So we have carcinogenesis and oncogenesis. Carcinogenesis is the formation of cancer cells. So Genesis means the formation of. And then oncogenesis is basically the formation of tumors. So we know that there are factors that can increase the risk of one actually developing cancers. So we have environmental factors, hormones, or viruses. So for environmental factors, we have smoking, tobacco use, alcohol drinking, sexual reproductive behaviors, UV radiation, other pollutants and irritants that can be found within the environment. So for oncogenic viruses, you have human papillomavirus, hepatitis B virus, HIV, and herpes simplex virus. So these are some of the viruses that can actually cause the formation or the development of cancer. So in order to better understand cancer, we need to know normal and malignant signs and symptoms, alright? So for normal cells, you have a limited cell division. So the cell has a lifespan, and it will develop over that lifespan and then die. Usually. It undergoes apoptosis, which simply means cell death. It's a controlled growth, well differentiated, adhere tightly together, contact inhibited. That means that it does not float to another area. The cell must also be euploid. That means it has the exact multiple of the haploid cell. So some signs and symptoms for malignancies. So rapidly dividing and multiplying. Do not undergo apoptosis, which means it continuously grows. The cycle is not broken. It is uncontrolled growth. It has anaplastic morphology, which simply means poor differentiated cells. It adhere loosely together. That means the cells can flow to different parts of the body. And it has an aneuploid number. So basically the numbers are not even multiples of the haploid cells. So there are some preventative measures that you can take in order to decrease your chances of developing cancer. So primary level care is basically your prevention and screening and client education. So in screening, you know that you are actually testing to see if you actually have this disease before you even develop any signs and symptoms. Client education, it is most important to educate a client of the signs and symptoms they need to look out for themselves in order to either have an early detection of any development of any metastasis. And also prevention. If you are a smoker, you can decrease smoking. If you're a non-smoker, keep it that way, and avoid secondhand smoking and avoid environmental pollutions. So for your second level care, diagnostic tests, which means that you notice that there is something going on with the body, so you went and got a diagnostic test done. For example, you notice a nodule in the breast and you think that it might be cancerous, or the healthcare provider might think that it is cancerous. Then they will actually do something like a biopsy in order to either confirm or deny that you actually have metastasis. Also, under second level care is treatment, which can include surgery, radiotherapy, or chemotherapy. So any of these are under secondary. So primary again, prevention, screening, and education. Secondary, diagnostic tests, treatment, which may include surgery, radiotherapy, or chemotherapy. Now, tertiary level of care is basically end of life or psychosocial issues. So debulking therapy is the removal of as much cancer tissue as possible in order to provide this patient with comfort. So basically in a tertiary level of care, the most important thing is providing the client with comfort and trying to avoid any other issues that may arise from the existing condition that you are dealing with. So let's go through it again. For primary level of care, we have our health promotion. So dieting, it is very important to have a good diet with anything full of fruits and vegetables. Avoid your alcohol, avoid smoked or charred meats, stuff like this can actually alter the immune system and aid in the development of cancer. Avoidance of carcinogens, as I said, avoid smoking, too much sun exposure. It is usually recommended that you avoid sun exposure from about 10 a.m. to 4 p.m. Also, make sure you have regular screenings done. Regular screenings does not mean that you have a disease. It means that you just want to ensure that you get yourself checked in order to see if there's anything abnormal going on. For your second level prevention, again, you can do your common lab tests. You can do radiology procedures, endoscopic procedures, and biopsies. As I said, you will have a hunch that you may have something going on, or the healthcare provider realize that there might be something possibly going on. So you need to do some tests in order to confirm or deny your suspicions. And as I said again, your tertiary level is basically for comfort. So a good example is your debulking, removing of as many tumor cells as possible, or as much of the tumor as possible, in order to provide comfort and relief for this patient. Okay, so just a quick info on tumor classifications. So you can basically stage a tumor by using TNM, alright? So TNM. T is the primary tumor size, N lymph node involvement, and M metastasis. Please refer to your book to see the exact numbers of the values, or the breakdown of how the grading is done. Alright, so let's talk a little bit about classification of tumors by tissues and where they're located. So your sarcomas are usually started in bone tissue or subcutaneous tissue. Lymphoma, it's in the name. It usually begins in the lymphatic system. Your gliomas usually begin in the brain or spinal cord. Remember, glioma, brain or spinal cord. Osteoma, it's in the name. Osteo means bone, usually begins in the bone. Lipoma is usually in adipose tissue. Lipoma, adipose tissue. Adenoma usually begins in a glandular structure of epithelial tissue. Alright, again, adenoma, glandular structure of epithelial tissue. And finally, melano, which starts in the skin cells, or cells of the epidermis. So, there are some steps that need to be taken in the secondary level care by nurses. So you must ensure that the patient had pre-op teaching, nutritional promotion, pre and post-op, pain control, monitor for post-op complications, cough and deep breathe. That's most important whenever anyone has gone for any surgery. So again, these teaching are done before the person actually go in for surgery. So you cough and you deep breathe, incentive spirometry use, anti-embolic stockings, exercise, and ambulation. Get that patient walking as soon as possible. You may also need to address like body image disturbances. So, you keep this in mind. You speak to the patient about, the changes that they may experience, or the changes that they are going to see once they have done surgery. Alright, if this patient is going for, say, chemotherapy, so prior to the administration of chemotherapy, you have to make sure that they are well hydrated, and you give them antiemetics, because one common sign and symptom of the administration of chemotherapy is nausea and vomiting. So you definitely want to make sure they have some form of antiemetic. So with chemo agents, the patient needs to be on Vesicant Precaution. Basically, Vesicant Precaution is looking out to see if the line is infiltrated, because this chemo agent can damage and destroy healthy tissue. So you want to make sure that this chemo agent is being administered directly into the vein and not into the surrounding tissue. After the administration of chemotherapy drugs, you definitely want to look out for myelosuppression, which basically can increase the patient's risk of developing infection, bleeding, fatigue, GI complications. So definitely look out for myelosuppression. Right, another treatment for cancer is radiation therapy. Radiation therapy is basically using a high energy beam on target cells. So this is more localized, while chemotherapy is general. So chemo will affect all cells, both the cancer cells and the healthy cells, while radiation therapy is more targeted and will be targeted to the specific cancer cancer cells. With radiation therapy, you also run the risk of developing myelosuppression also. So your infection, your bleeding, fatigue, GI symptoms. Whenever you're doing radiation therapy though, please practice good skin hygiene. Good skin hygiene. Alright? And please do not use any emollient or any lotions on the site where the radiation occurred, because this can actually burn the patient. All right, because radiation therapy can cause desquamation of the skin. So please do not use any oils, any emollient. That area should be clean and dry. Alright, another treatment for cancer is brachytherapy. Brachytherapy is usually seen with prostate cancer. Now, brachytherapy is implanted radiation. This means that the patient must be in a private room. Again, the patient must be in a private room. Alright? Radioactive caution sign limit visitors to half hour stays. No visitors under 18. No one that's pregnant should be interacting with this patient. Rotated nurses assigned. Wear dosimeter. So whenever someone is on brachytherapy, remember time, distance, shielding. For the time you want to spend at the least amount of time with this patient. So, are you going to do cluster care? Definitely. You do the cluster care so that it decreases the amount of time that you actually have to go in the patient room. Alright, so you do your cluster care. For your distance, you should try to stay at least 6 feet away from the implanted site. Alright? And for your shielding, you should always wear a lead apron. Basically, a lead apron will a lead apron will serve as a barrier to protect you from any emission from the implanted device. Alright, so let's do a checkpoint real quick. So what is the most important factor in cancer survival? Definitely early detection. Alright, the earlier you detect the cancer, the earlier you can start treatment and the better your prognosis. Alright, what is a definitive tool for diagnosis of cancer? It is not your self-breast examination. It is not what you are seeing with your eyes. I mean, you might have a hunch, but biopsy, for instance, that's a definite indication of cancer. So definitely we would, do like a biopsy for a definitive answer whether a person has cancer or not. What is a priority nursing concern during the administration of chemotherapy? Vesicant, precaution. Alright, Vesicant will burn and irritate the patient's skin, so make sure practice Vesicant precaution. And also, what is it meant by time-distance shielding? We just spoke about it. The time you spend with the patient, we usually recommend about 30 minutes at a time. For distance, stay at least 6 feet away from the site where the implant is. And shielding, make sure you wear a lead apron and also a dosimeter in order to actually see how much you are being exposed to the radiation. Alright, so what are some focus assessments that you need to do with cancer patient? Definitely check for signs and symptoms of bleeding. You're going to do your platelet check, your complete blood count or your blood panel, your hemoglobin and hematocrit. Definitely check those. Check the gums for stuff like stomatitis. Stomatitis is like the soring of the gum, so you have to stay away from like citric foods and stuff like that. Stool, check the stool to see if there's any blood. You might have to do an occult test to see if there's any masked blood. Check the urine, check the skin, and always check the level of consciousness. For infection, definitely temperature, WBC. For pain, you definitely want to check a patient for pain whenever they have cancer, because a patient can experience extreme pain when they have cancer. So definitely check their pain level, their coping skills, and the patient knowledge. You really want to know what the patient know about what's going on with them and how you can further educate this patient. Alright, so let's talk about myelosuppression for a quick minute. So when a person has myelosuppression, please look out for 3 things: anemia, leukopenia, and thrombocytopenia. Anemia may be indicated by notifying that the blood count has decreased or your red blood cells has decreased more 10% or more. For leukopenia, you know that there is a decrease in your leukocyte production or your white blood cells. Thrombocytopenia is a decrease of platelet levels, so you definitely want to check again anemia, leukopenia, and thrombocytopenia. Alright, so whenever someone has any cancer, they can develop an oncologic emergency. I will be covering oncologic emergency in my next video, so stay tuned for that. Alright, so what is one of the most adverse effects of receiving anti-neoplastic therapy? So, come into my mind right away is immunosuppression. Once you're on any form of, anti-neoplastic therapy, you are definitely gonna have a decreased immunity, because remember, this therapy is killing both good and bad cells, right? What is it meant by neutropenic precautions? This means that you are no longer protecting yourself from the patient. You are protecting the patient from you. The patient has a decrease in immunity. Alright, so for this patient, you definitely want to don your PPE, have your mask on. Remember, you are protecting the patient from you. You may have a cold, or you may have, some form of small virus that is going on with you, but your body is able to handle it. With a person who was on anti-neoplastic therapy, they are very immunocompromised and will not have a response in order to get rid of this infection. So definitely neutropenic precaution. So stay away from flowers. Do not have any flowers in their room. Stay away from raw foods. Their food must be, and I repeat again, their food must be cooked thoroughly. Avoid, if you can, from reheating food, because we know once we cook food and it sits, there might be a development of bacteria. Again, a normal person may be able to handle a small amount of bacteria. The patient who is immunocompromised cannot. So stay away from reheating food. Stay away from raw meat. So like your sushi, you wouldn't want someone to be eating sushi who has, an immunocompromised system. And lastly, what is the role of a nurse in hospice care? So basically in hospice, you know that it is basically end of life care. So you want to provide as much comfort for this patient, make sure they are getting the adequate amount of nutrient. So anything that can make this person feel most comfortable in their transition. For my next video, I will be covering cancers to specific parts of the body. So please remember to like, share, comment, and subscribe. As I usually say, if there was something that was unclear, you can always leave a comment down below. You can also find my email on there. You can shoot me an email if you want to email me privately, and that's fine. So thank you guys for watching, and all the best.